The Democrats want to cover the uninsured, but also preserve the employer-based health care system. Now, the exact plan, the details, still in flux, but we're going to break it down, what we know, how we're going to explain how it could affect your doctor visit and your monthly budget. Jeanne Sahadi, our good friend and senior writer at CNNMoney.com, is here. Jeanne, if you get health insurance through your job, through work, not a lot is going to change for you in the very beginning if this plan happens.
Right. There's the near term and the long term for people with what's called ESI. In the near term, premiums are not expected to go down measurably. It's unlikely your employer is going to drop you into the public exchange that they want to create, a national insurance exchange, the supermarket. What could happen, though, is that within 5 years, all insurance plans, those from employers, those on the exchange, will have to conform to certain regulations. What you'll hear President Obama said this week, what Nancy Pelosi said this week was, you will have your out-of-pocket costs annually capped. You will have the cap on lifetime benefits from a plan removed. You will be guaranteed coverage for pre-existing conditions. So that could help somebody with employer-sponsored insurance today, because it means a couple of things. Within 5 years, and really we're talking 2018, because this won't get underway until 2013, you might see a reduction in your out-of-pocket costs if that cap soon applies. You also might be freer to leave your job, because right now if you leave your job, you're like, oh, how am I going to get insurance, especially if I have a pre-existing condition. Now you know there are going to be some options out there for you.
And, so this is most people at this point. Most people still have their coverage through their job. You also point out you could be required to pay a tax. You don't have to pay tax on this benefit right now that you get through your job. That could be on the table.
Couple of different things on that. We don't know what the pay-fors are going to be. The House bill that everyone's talking about has a surtax on the wealthy. The threshold for that was couples making $350,000 or more. The House Speaker, Nancy Pelosi, wants to push it up to $500,000. We don't know what's going to happen there. The Senate Finance Committee has yet to put out its proposals. The leading idea had been to tax your benefits at work, which are currently tax-free, the portion your employer pays. Don't know what's going to happen there. And now there's a competing idea coming out to tax insurance companies and employers who provide these Cadillac plans. But that could get passed down to you by way of cost. Who knows?
Let's talk about the people who buy their own insurance. What does it mean for people, the Democrats' health care proposals, for people who buy their own health insurance?
In the near term, it could be a benefit for them because it's very expensive to buy on your own in the individual market. Those folks will be immediately eligible to go into the exchange when it opens. And the idea of the exchange is you have a lot of different plans competing with each other for your business. So, and also if they're very low income, they can qualify for a subsidy. The subsidy is if your income takes you to 400% of poverty level. So that's another potential
Let's talk about the people who don't have insurance, the 49 million projected for next year. They get the most out of all of this.
There's going to be a mandate to buy insurance, so they will have that. But again, if they're low income, they can't afford it now, they will be subsidized to buy it. They will have more choice in plans than they do now. They will have all those protections that will immediately apply to plans in the exchange. You know, guaranteed coverage if you have a pre-existing condition. They can't toss you out of a plan if you get sick, that kind of thing.
All of this still in flux, of course. And there's two tracks I keep saying. There's what your health care going to look like, but then also how we're going to pay for it. So two different kinds of very complicated and political discussions going on. Jeanne Sahadi, thanks so much, Jeanne.
Thank you.